Good morning. My name is Mauro CONTINI. I am a cardiologist. My expertise is the treatment of heart failure, and I'm working at the Cardiologic Center in Milan, Italy. I would like to speak to you briefly of the role of cardiopulmonary exercise testing in the management of heart failure. Cardiopulmonary exercise testing is a very useful tool in heart failure to diagnose an unexplained dyspnea, to define the limitations, the exercise limitation of the patients, but maybe more importantly is a very useful tool to define prognosis. We have several parameters that are able to define prognosis in heart failure patients by cardiopulmonary exercise testing. The most important one, the most famous one, is a peak VO2, that is the maximal oxygen consumption at the end of a maximal exercise testing. But this is not the only one. There are other very important parameters. For example, the ventilatory efficiency, that is the increase of ventilation during exercise with the production of CO2, and the higher the slope of this relationship, the poorer the prognosis of the patients. Other parameters are the presence or the absence of a periodic breathing during exercise, that is called exercise oscillatory ventilation. And this is a very, very strong predictor of mortality in heart failure. So when you meet this kind of ventilatory behavior in your patient, you should take into account that the prognosis of this patient could be very poor. It's very important to try to mix, to combine all these parameters in some kind of score to better define prognosis. In the past, there have been several attempts to create scores with different parameters derived from cardiopulmonary exercise testing, and these parameters has also been inserted in scores that take into account also parameters deriving from clinical or echocardiographic and so on variables in heart failure patients. The last born of these scores is a Mackey score, that is a score taking into account cardiopulmonary exercise testing using the peak VO2 and the VO2 slope as a major parameters, but also parameters from hematochemic, for example, the concentration of sodium or hemoglobin, or the renal function derived from the MDRD formula, and the left ventricular ejection fraction. And in a recent paper, this score has been validated as and seems to be even more powerful that other score already existing, like the Seattle model or the HFSS score. Thank you for your attention.